All right, let's talk metatarsal pads. My name is Dr. Meier at Third Coast Foot and Ankle, and I'm going to tell you about one of my favorite foot products, which are these little doohickey things called metatarsal pads. I also refer them as to a really large guitar pick. So the purpose of these pads is to be put kind of on the ball in the foot to take away pain that's happening in the front of the foot. Sometimes neuromas, we use these around neuromas, or when you just have that like metatarsal pain right behind your second toe. If you wear high heels a lot, you may be familiar with using these a lot. Now, the biggest problem with these pads is placement, and so there is a hot spot to put these pads that make them work like miracles. And that spot can be kind of hard to find. So the purpose of the pad is to take weight away from the ball of the foot. And so if you feel the bottom of the foot, you're going to feel this bony section. This is called the ball of the foot. And where you want that pad is not directly on top of that. You actually want it to kind of be back, not like in the arch, but like somewhere in between or just forward above the arch, so that when that pad is hitting, it's actually hitting right behind that arc of bones there, pulling the weight away from that area. Now, neuromas also live in this area, so this also works in pulling weight away from that nerve. Now, using these pads, obviously you can get these easily, and they just kind of sticky on, sticky off. You can put them directly to the shoe, you can put them directly to your foot, but oftentimes what we see is them slipping. When you come to the office, sometimes if we're trying to see how much this is going to help you, I will make like a removable pad that you can use over and over again, but after a couple of weeks, it usually wears out. So my preferred method of using this padding is actually to customize it to the patients. And so here we do make custom orthotics. And so with those orthotics, we do ours through a 3D printer. That allows us to actually pinpoint that specific spot where that pad would be most appropriate through a computer. You know, it's all digitized. And then that pad actually gets built directly into that insert. So you can kind of see that shadow. Now, not everybody needs the same size of pad either. And so as you can imagine, this looks like a bigger foot than mine. And so the size of that pad can vary both by like height, you know, so how prominent it is, but also then by width, depending on how wide the foot is. And so we do see a much bigger success with the use of pads when we do customize it to the individual patient for their individual pathology and of course their individual size. So this is a great way to kind of test it out. If you're on the right path, does this help? If it does help, it's worth the investment to go ahead and get something custom for you because it's your foot. These customized products usually last several years, so it's not something that you're replacing constantly, like these little sticky things that maybe last you a day, sometimes only a couple hours. So if you have more questions about that front of foot pain and how we can manage it long term to keep you comfortable, especially with metatarsal pads, feel free to give us a call here at Third Coast Foot and Ankle.